Good morning and welcome to Key Facts about Influenza and COVID. Today we have Arlene Schiff speaking. We're so glad that you could join us this morning. Just a reminder that this event is being recorded and will be posted live to Facebook and to our YouTube. Elderwerks is a not-for-profit 501c3 organization, and our mission is to provide seniors and their families with information, referrals, and guidance for senior living, home care, and support services to help make appropriate decisions. The guidance we provide helps seniors stay home well or transition successfully into a new senior living opportunity. We provide education on a variety of aging topics for consumers and professionals who work with seniors. Please add any questions that you may have into the chat box, and we will answer all questions at the end of the presentation. Now with that, I will go ahead and turn it over to Arlene. Good morning, everyone. Thanks for being here.
Good morning. Thanks, Kristen. Good morning, everyone. My name's Arlene Schiff. I am a nurse and education specialist with Elderwerks. I've been in the healthcare field my entire career and specifically working with seniors and their families and guiding them through this aging journey for over 20. So why don't we get started? We are almost in flu season, so let's go through some of the key facts about influenza as well as COVID. So what is influenza? It's called the flu. It is a contagious illness. It's caused by the influenza virus, and it affects your nose, throat, lungs. It can cause mild to severe illness, and it can at times lead to death. The best way to prevent the flu is by getting a flu vaccine each year, and this is stated by the CDC. And we know in the United States that flu season usually occurs in the fall and winter. Influenza viruses do spread year-round, but again, most of the time the flu activity will peak between December and February. And the overall health impact really varies from season to season. The CDC, I apologize for that, went through too many at one time. The CDC monitors the progress of flu season. It collects and it compiles and analyzes information on the influenza activity year-round in the United States. And the CDC puts out what's called Flu View. It's a weekly surveillance report if any of you are interested in tracking any of the flu outbreak. It's a report that it finds out where and when the activity is occurring. It tracks influenza-related illnesses. It determines what influenza viruses are circulating, and it also detects changes in the influenza viruses. It also measures the impact that influenza has on hospitalizations as well as deaths in the United States. So there's a good amount of information that you can find again at the CDC website. So what are the signs and the symptoms that you may see with the flu? Again, we know it peaks seasonally, and it could even start as early as October. And we know that the symptoms are mild to severe. You might see fever, chills, cough, sore throat, and you can see that sometimes it's a little bit difficult to determine, is it the cold, is it the flu, what are you going to see? With a cold, you're going to rarely see a fever. You're more going to be congested. Aches and chills are probably pretty usual with the flu. You're going to be fatigued, sneezing. That's not as significant as it is with a cold, so that's where you see a little bit difference. Stuffy nose is, of course, very common with a cold, not as common with the flu, just like a sore throat. If you've got, chest discomfort and a cough, that's very common. And again, it's very important to monitor your symptoms. You're going to feel headaches, fatigue. There's, a variety of different symptoms. But again, these are what you can see on the screen are the differences between flu and cold. Now, most experts believe that the viruses spread mainly by droplets made when people with the flu cough or sneeze or talk. So it's respiratory droplets. And again, when you're standing near somebody, if they're coughing and they're not, putting their elbow to their mouth or covering their cough in some way, if you're near them, that's how you get infected. These droplets can land in your mouth or your nose, or it can be inhaled in your lungs. You can also get, sometimes you can get the flu by touching contaminated surfaces. The flu can survive on surfaces like doorknobs or countertops. For a few hours. It's less likely, but possible that that's how it's transmitted. If you shake hands with somebody who is infected, for instance, if someone who has just coughed in their hand or rubbed their nose and you go to shake their hand, there's a good chance that you've been contaminated. And again, if you touch a contaminated surface, it's possible that you can contract the flu as well. But again, being in close proximity with someone that's infected increases the likelihood of transmission. So if you're in a crowd or shared spaces, like public transportation, or if you're living in tight quarters, the virus can spread quickly. Sometimes people who are infected with the flu can spread the virus even before they show symptoms, and that's typically one day before symptoms start. You do remain contagious for up to 7 days after being sick. The key really is if you have a fever, stay away from people. And again, you tend to be more sick if you have a weakened immune system. But prevention is really the key. Again, you want to cover your mouth and nose with whether it's a tissue or your elbow when coughing or sneezing, and washing hands frequently. And we'll go through this many times over the next few minutes because these are the things that are so important. So how serious is the flu? The flu is potentially very serious. It can lead to hospitalizations and sometimes even death. We know that every flu season is different. That's why there's different strains. That's why there's different vaccines every year. The flu can affect people differently, but during a typical flu season, we know that millions of people get the flu. Hundreds of thousands of people are hospitalized, and thousands to tens of thousands of people do die each year from flu-related causes. During the 2022 to 2023 influenza season, the CDC estimated that influenza was associated with 31 million illnesses and 14 million medical visits. There were over 360 hospitalizations, and there were 21,000 deaths. The flu can mean just a few days of feeling bad or missing work or school or events, but it can result in more serious illnesses. And again, the CDC estimates that between 70 and 85% of flu-related deaths in the United States occur among adults that are 65 and older. And as many as 70% of flu-related hospitalizations also happen to be people in this age group. And research does show that the flu vaccine can lower your risk of hospitalization and death from influenza. There's somewhere, again, around 20 to 25,000 deaths in the United States each year that can be diminished by getting an influenza vaccine. So when is the flu contagious? You may be able to pass the flu to others before you know you're sick. And that's, again, usually the day before you start getting symptoms. But we certainly know that if you are symptomatic, you are contagious. Most healthy adults, again, one day before they can infect. Younger children and others with weakened immune systems can infect others for a longer time. So complications from the flu. Most people who get the flu do recover in a few days to, just under 2 weeks. But some people do develop complications such as pneumonia as a result of the flu. And some of the pneumonia or people with the flu, there can be life-threatening situations and result in death. Sinus and ear infections are examples also of moderate complications from the flu, but pneumonia is definitely a more serious complication that can result from whether it's the flu virus alone or other co-infections of the flu virus as well as bacteria. Other possible serious implications that can be triggered by the flu are inflammation of the heart, called myocarditis, or even the brain, which is called encephalitis. There's infection of muscle tissues, or again, more severe multi-organ failure that occurs sometimes with respiratory and kidney failure. The flu virus, the infection of the respiratory tract, can also trigger really sometimes extreme inflammatory responses in the body, and it can lead to sepsis. And that's a life-threatening response to infection. If you have chronic medical problems, the flu can make those worse as well. For example, if someone has asthma, they may experience asthma attacks while they have the flu, or chronic heart disease that could be worsened by or triggering by the flu. So again, you want to be very careful with any underlying conditions, and again, always consult your doctor. So who is at high risk for complications? If you're 65 years and older, you're automatically at high risk. Children under 2 years old are also at high risk. People with asthma or chronic lung disease, such as COPD, chronic obstructive pulmonary disease, or cystic fibrosis. If you have neurological conditions, you're at a higher risk. Blood disorders like sickle cell, or endocrine disorders like diabetes. If you have heart disease, whether it's congenital or congestive heart failure or coronary artery disease, you are at higher risk for complications. If you have kidney disease or liver disorders, people who have even a body mass index, which is your BMI, of 40 kilograms or higher are at risk. People younger than 19 years old that are on long-term medications or even taking aspirin every day, you can be at risk. If you have a weakened immune system due to diseases like HIV or AIDS, or some cancers like leukemia, or even medications, if you're receiving chemotherapy or radiation, or if you're on chronic corticosteroids or other drugs that may suppress the immune system, you're at a higher risk. People who have had a stroke are also at a higher risk. So these are just things to be aware of. So prevention. CDC recommends that everyone 6 months of age and older get a flu vaccine every year. To date, the vaccines are the best line of prevention. And according to the CDC, again, the best way to protect yourself against the flu and its potentially serious complications is with an annual flu vaccine. And the vaccine does have many benefits. It's shown to reduce the risk of getting sick with the flu. It also reduces the risk of more serious flu outcomes that result in hospitalizations or even death. So although immune responses to vaccinations may be lower in older adults, studies have shown consistently that the flu vaccine has been effective in reducing the risk of medical visits as well as hospitalizations in older people. There are higher doses of a flu vaccine that are potentially more effective than the standard doses. And people in the age group of 65 and over are recommended to get that higher dose of a vaccine. They, again, reduce the risk of getting sick, being hospitalized, or even dying from the flu. So it's very important for people who are at higher risk to get that vaccine. But again, I cannot stress over and over again, make sure you discuss all these things with your healthcare professional. Again, we know that how it's spread. You want to avoid being near people who are sick. You want to cover your coughs and sneezes. Hygiene, hygiene, hygiene. Wash your hands often, and take steps to even improve the air quality. Clean, frequently touch surfaces. I know that when I was sharing an office with other people, every time I would come in, I would have my Clorox wipes and wipe off my keyboard and my desk surfaces because flu spreads rapidly in work offices. So you want to make sure that you're cleaning your surfaces as well as washing your hands. So again, now we talk about, should I be vaccinated? And the vaccine, we know, reduces the risk of hospitalizations from flu in high-risk individuals by 35%. We know already during the Southern Hemisphere's 2024 flu season, which typically runs from April through September. And this is from a recent report from the CDC. And the researchers noted that the vaccine's effectiveness could be similar in the Northern Hemisphere if the similar flu strains circulate here during flu season. And we know lowered immunity and living with chronic health conditions make the flu more likely and more dangerous than when you were younger. And so should you be vaccinated if you have common high-risk conditions like heart disease, diabetes, asthma? Yes, chronic illnesses, you for sure should be vaccinated. Again, and I will say it over and over again, but talk to your healthcare professionals to confirm, what your situation is. So again, for this year, the CDC's that says that for elderly people get the higher antigen level because our immune systems aren't what they used to be. It decreases when we age. And the best time to get the flu vaccine is absolutely now. So it's usually September or October. So by the end of October, you should have your vaccine. If you haven't gotten it by the end of October, you should still get it. But again, the prime time to get it is now. It takes about 2 weeks after you're vaccinated for immunity to fully set in. So who shouldn't be vaccinated? Once again, I will preface this all by saying always check with your doctor. But the people who should not receive a flu vaccine is anyone who has had an allergic reaction to any component of the vaccine, which includes egg or egg products. But in addition, anyone who has had an allergic reaction after a previous dose of any flu vaccine should not have it. If you have ever had Guillain-Barré syndrome, which is severe muscle weakness after a previous flu vaccine, you should make sure you talk to your doctor about whether you should be getting that vaccine or not. If you have a compromised immune system, or you're receiving therapies that suppress your immune system, you may want to get that higher dose if you are getting the vaccine. But again, check with your physician. If you get the flu, what do? Stay home. Stay home, don't contaminate others. Call your physician or your healthcare provider for the possibility of getting an antiviral medication to treat the flu. It may lessen the severity and duration. Utilize telehealth if possible. Stay hydrated, drink lots of fluids, use a humidifier to moisten the air, breathe in the steam from your shower if you're congested. Get plenty of rest, but also don't just lay stagnant. You still want to be up and about. It's better for your mental status as well as your physical status. But again, you want to make sure you're getting enough rest. Make sure you cover your cough, dispose of used tissues. When you're disposing of the used tissues, wear gloves if you can as you're bagging these up. And again, wash your hands immediately so you don't contaminate others. After you use a tissue and throw it away, wash your hands. If you do have a fever, use a fever-reducing medication to make you feel better, like Tylenol. But again, make sure you check with your physician to make sure there's not any reason that you should not be taking Tylenol. Cover that cough and cover your sneeze. So important. Let's talk a little bit now about COVID. Flu and COVID-19 are caused by different viruses, but again, can be spread very easily among people. Flu is the influenza virus, and COVID is caused by the SARS-CoV-2. Both can give you fever, cough, headaches, body aches. They're spread similarly. They're transmitted by, small particles that come from your nose and your mouth when you sneeze, when you cough, even when you sing or talk. And that again raises the possibility of infecting people who are in close proximity. Infected people with COVID may not have symptoms, but can still pass along the virus. Both influenza and COVID can be spread, again, before you develop symptoms. So what are the COVID symptoms? First of all, this list does not include all the possible symptoms, and the symptoms change with the different COVID variants, and they also vary depending on your vaccination status. But possible symptoms include whether fever and chills, cough, shortness of breath or difficulty breathing, sore throat. You can have congestion or a runny nose. If you have a new loss of taste or smell, that is a very telling sign. If you're fatigued, muscle or body aches, headache, even nausea, vomiting, or diarrhea. But again, we do know that that people with mild or even asymptomatic illnesses are usually no longer contagious after 10 days. People with moderate or to severe illness, or are moderately to severely immunocompromised, they may remain contagious for a few more weeks after. And again, these are all symptoms and information from the Centers for Disease Control and Prevention. Once again, who should be vaccinated? If you have not been vaccinated before for COVID, you should be vaccinated. It's very important that the vaccine protection even if you've had the vaccine, decreases with time, and the vaccines are updated according to the latest strains. So getting that new and updated vaccine protects you from the current circulating strain. COVID vaccines have been proven to be highly effective in preventing the most severe outcomes from the COVID infection. The FDA, the U.S. Food and Drug Administration, has signed off on updated versions of the vaccines that target more recent variants of the virus, especially what came behind the summer surge. And we know that beyond restoring protection from a short-term illness, the vaccines can reduce the likelihood of suffering the effects of long COVID, which we know has also impacted an estimated 17 million adults in the United States. The new shots are Moderna and Pfizer. There's a third one from Novavax. They're all being available now to pharmacies and doctors' offices across the country. And again, infectious disease specialists really hope that the new vaccines will quell the lingering summer spike and keep cases from swelling in the fall and in the winter. One researcher was quoted as saying, "I think the population would really like to put the pandemic in the rearview mirror and not think about it anymore. But the reality is the virus is still very much with us and still continues to cause issues for the population in the United States." So if we know that the vast majority of COVID hospitalizations that occurred last year between October and March were among individuals who were not vaccinated or not up to date on their vaccinations, and this was according to the CDC. It's important that everybody get vaccinated, especially anyone over 60. Can't stress enough that the majority of the severe complications from COVID, and unfortunately the fact that we still have deaths from COVID, they're more likely to be among people who are older than 60 and who have not been vaccinated. And important to know that you can get your COVID and flu shots at the same time. Not everyone will experience side effects after vaccinations. Some people do. Some common side effects are pain and swelling and redness at the injection site. You may be slightly fatigued or have a headache or muscle pain, but again, these side effects tend to be mild and generally go away in a day or two. But again, the advice from experts and the CDC is that the flu and COVID vaccines can be given at the same time, at the same appointment. So there's no need to make two separate trips, whether it's to the pharmacy or your doctor's office. You can also get the flu shot with an RSV vaccine, which is also recommended just one time for everyone that is 75 years and older, as well as if you are between 60 and 74 years of age with certain health conditions. So if you're due for all three vaccines, it's okay to get them all at one time per the CDC. So common symptoms of cold and flu and COVID-19, it can get very confusing. First of all, can you test yourself at home for the flu? Yes, you can. There's at-home tests that check for both COVID and or the flu. Since COVID-19 and the flu do share some similar symptoms, testing for both viruses is important. Also want you to be aware of RSV. It's common respiratory virus that affects the nose and throat and the lungs, and sometimes RSV symptoms also make it difficult to distinguish from the common cold or other respiratory viruses. So it's important to get tested and know what you're dealing with as well. So we take a look at these common symptoms. We see that the flu and COVID, there's usually a fever and chills and headache, muscle pain. So very different, very difficult to distinguish between the two. And the cold, you'll more see that coughing and sneezing. But more severe things like shortness of breath and difficult breathing are more likely with flu or COVID-19. But if you ever are feeling worse and your breathing is getting difficult, please notify your healthcare professional immediately. So the CDC recommends that people stay home and away from others until at least 24 hours after their symptoms are getting better, that you don't have a fever at least for 24 hours. And depending on the length of symptoms, this period might be shorter. But again, it's, you can check with the guidance by the CDC as it does change. It's important to note that the guidance doesn't end with staying home and away from others when sick. The guidance from the CDC encourages added precautions over the next 5 days after symptoms. Again, stay away from others because people do remain contagious sometimes beyond that stay-at-home period. So make sure that you are maintaining precautions. Again, take steps for cleaner air, bring in fresh air into your home, gather outside and as opposed to inside, use an air purifier, hand washing, so important. If need be, wear a mask. We know that does help, but staying home, stay away from others, get tested. These are all very, very important things to follow. So we know that flu season is ahead. Not everyone who gets the flu needs to see their doctor, but people over 65 do need to. So don't postpone treatment. Try to stay home, whether it's flu or the COVID or RSV. They are all very contagious. So, and especially if you have a fever, stay home until you're fever free for 24 hours. Have I reminded you all to wash your hands? I don't know if you've heard that you're supposed to sing happy birthday all the way through while you're washing hands. That's to make sure that all the virus has left your hands. Hydrate, water, juice, chicken soup, decaffeinated drinks. Caffeine will dehydrate you as well. Moisten your sinuses. Use a neti pot that helps relieve congestion in your nasal passages, or take a steam shower. That will help also. You can take Tylenol, again, if you check with your healthcare professional, whether there's drug interactions or other precautions, but they do help in reducing fever and alleviating aches and pains. But you need to, again, know what the interactions are with any drugs that you may be taking, or what your personal risks are because of any chronic conditions and your age. We want you to stay physically active because, again, it's better both physically and psychologically. If you feel that your symptoms are getting worse, don't tough it out. Call your doctor. It could be the early stages of pneumonia. And, the older we get, the more personal stories we have. I have a 30-year-old son who was supposed to go on 2 work trips, first to Miami and then to Singapore. And he called me and he said, I did a COVID test. I don't think it's COVID, although I feel like I do the last time I had COVID. My chest is tight. I'm exhausted. I can't, go for my daily jog, and I'm not sure what I should do, Mom. And I said, first of all, you're not getting on an airplane tomorrow unless you are tested. Go see the doctor, get a chest x-ray, an EKG. Even though you're 30 and healthy, as soon as, I hear, oh, I've had some chest pain, you've got to get that checked out. So sure enough, he went and he got checked out. They gave him a breathing treatment, which made him feel much better. And the doctor said, it's okay for you to travel, and your EKG was fine. And first glance, your chest x-ray looks good as well. So he waited a day, got on the plane to Florida. He no sooner does he land in Florida than he gets a call from the doctor stating the chest x-ray shows that you have pneumonia. So again, you're feeling a little bit worse, and your chest is hurting. Make sure you see your doctor, get a chest x-ray, make sure that you know what's causing that chest pain. And my recommendation would be don't get on an airplane, and either infect other people or make it worse for yourself. So what we want you to do is outsmart the germs. Maintain your immune system. We know as we age, our immunities decrease. Get vaccinated. Maintain good hygiene. Wash your hands. Don't touch your face. Cough into your elbow. And if you do cough or you're holding a tissue, after you throw it out, again, wash your hands so you're not contaminating other surfaces as well. Disinfect high-touch surfaces, doorknobs, desks, tables. Make sure you are disinfecting them as well. Your faucet, the handles on your faucet, make sure you disinfect those as well. Avoid close contact with those who are sick. People sometimes think it's an allergy. You have fall allergies, spring allergies. Sometimes it's not. So if someone is coughing or sneezing, take a step back. It's okay. Stay up to date with the CDC recommendations, but always check with your healthcare provider. If you have symptoms, it's worth a call to your healthcare provider. So I hope you all stay well through this flu season and get your vaccines, know what you're dealing with, and always check with your physician. Appreciate you all joining us here today. Kristen and I can stay on for a little bit and answer any questions you may have. But otherwise, get out, enjoy this beautiful day, the sunshine, get some fresh air and exercise, and get your vaccines. Thank you.